When it comes to AIDS, many people adopt a seemingly indifferent attitude, believing they are immune to the disease. However, the reality is that the AIDS virus knows no age or gender boundaries. Anyone can become infected. In Nanjing, a doctor specializing in infectious diseases treated an elderly man in his 80s who contracted HIV due to frequent extramarital affairs. Tragically, he transmitted the virus to his wife, leading to her torment in later years, with medication dominating her life. As a husband and father, the elderly man not only jeopardized his own life but also plunged his family into a tragic abyss. Additionally, there's a case involving a woman engaging in frequent extramarital affairs and cohabitation during her husband's business trips. She eventually contracted HIV and transmitted it to her husband and newborn child, resulting in a devastating tragedy. Such behavior leads to discrimination against AIDS patients, but the truth is that most infections occur through unprotected sexual activities. Therefore, preventing AIDS starts with avoiding risky behaviors such as infidelity or soliciting sex, which not only jeopardize one's health but also endanger the well-being of partners and family members. What we need now is more attention and understanding, not discrimination and judgment. Let's collectively safeguard the health of every individual. In 1985, China discovered its first AIDS carrier. Media portrayed AIDS as a disease associated with capitalism, blaming domestic AIDS patients for their supposedly indulgent lifestyles. In the 1990s, the primary mode of HIV transmission in China shifted to blood transmission due to poverty and encouragement of blood donations without proper health conditions, especially in rural areas. Many children were born with HIV, commencing a countdown on their lives. Who can say these AIDS orphans deserve their fate? Who can say those accidentally infected deserve it? Who can say those infected by their partners deserve it? Let's not view people with HIV as monsters. Our common enemy is the virus, not our fellow citizens. Recently, a case drew attention, where an elderly man contracted AIDS not through blood transmission or drug use but through sexual contact. This reflects a significant characteristic of AIDS patients in recent years. Statistics from the Chinese Center for Disease Control and Prevention show a substantial increase in the proportion of new HIV cases among men aged 60 and above, rising from 41% in 2010 to 21% in 2020. Seeing news of elderly people contracting AIDS, some may criticize them for lacking morals or being shameless. In reality, many elderly people still have sexual needs. According to sexologists, 94% of men and 84% of women over 60 still engage in sexual activities. We cannot label elderly people and AIDS patients as immoral. We should respect everyone's rights and dignity, facing AIDS together with more attention, tolerance, and understanding. Let everyone openly discuss and address their sexual needs without feeling ashamed or inferior due to societal bias and discrimination. At the matchmaking corner in the park, when asked about the most romantic thing he had done, a 60-year-old man named who replied, "Looking for love." This seemingly untimely answer hints at the long-neglected sexual needs of the elderly. Due to a lack of discourse and relevant health knowledge, elderly people often avoid discussing sexual topics, leading to a sharp increase in sexual risks. With more elderly people contracting AIDS, we should not simply accuse them of immorality but offer more understanding and care, intensify AIDS prevention campaigns, and prevent this virus from causing more tragedies. Sexual activity is not exclusive to the young, it's a basic human need. Everyone has the right and freedom to pursue it. Therefore, let's focus on the sexual health of the elderly and ensure they can enjoy a healthy and fulfilling life.